Physician 3 will explain the symptoms of heart failure.
The symptoms of heart failure is the primary symptom of heart failure is the chest pain, and the next one is irregular heartbeat, and the edema, which means edema built up in the ankle, foot, and face. Persistent cough, which means continuous cough, fatigue, weight gain, and shortness of breath.
Insufficient oxygen supply and dysfunction of heart muscle leads to fluid accumulation in our body, leads to edema. Next, Kalki will explain the classification of heart failure.
There are 4 classifications. In first class, there will be no symptoms during any activity. In second class, there will be mild symptoms. In third class, there will be marked symptoms. And in fourth, there will be symptoms at rest also.
In class 4, patient is having symptoms during that rest period also. Lakshmi Priya will explain the diagnosis of heart failure.
Diagnosis, history collection is followed by a possibility physical history of patient, physical examination followed by 4 methods: inspection, calculation, auscultation, and percussion. ECG to rule out electrical activities of heart, echo to rule out valvular insufficiency, CT and MRI to rule out real image of heart, cardiac catheterization to rule out blocks in heart.
Physician will do cardiac catheterization to know the any blood clot in the heart. Next, Pramita will explain the dietary management for heart failure.
Lifestyle management, diet modification, no sodium diet, limit fluid, exercise, weight management, smoking cessation, and alcohol reduction.
The patient is a chronic smoker or alcoholic. They have to inform the patient to stop their habits. Next, Soundarya will explain the medical management for the heart failure.
Medications are ACs inhibitors, beta blockers to prevent heart attack.
AC inhibitors, ARBs, and beta blockers to reduce the blood pressure and management for the hypertension. Next, diuretics is to reduce the workload of the heart and excrete the excessive fluid in the body. Next, Mahilakshmi will explain the procedures of heart failure.
Procedure, implantable cardioverter defibrillator, prevent cardiac disease, heart valve repair, valvular causes prevent, coronary angioplasty, restore blood flow, left ventricular assist device to weaken the heart pumps blood to restore, heart implant to end stage heart failure to treat it.
Depends upon the causes, the physician will do the procedure. Thank you. We will see about the detailed note on procedures.
Implantable cardioverter defibrillator.
Implantable cardioverter defibrillator is to prevent the sudden cardiac arrest in the heart failure patient. Next is
Cardiac vessel pronunciation therapy.
next is cardiac resynchronization therapy. This procedure is to improve the heart pumping in certain patients. Next is
Coronary angioplasty.
or bypass surgery to restore the blood flow in coronary artery disease patients.
Heart valve repair.
Heart valve repair or replacement for valvular dysfunction. Next is
Left ventricular assist device.
for advanced heart failure patient. In class 4, patient is having symptoms at rest also. For this kind of patients, we will